Autoimmune rehab is for you if you think you have an autoimmune condition, know you have one, and are struggling, or just want to listen and learn all you can about how to heal from autoimmune conditions. Have you ever asked yourself any of these questions? Why won't medications heal my autoimmune condition? I've already given up gluten and dairy, but I still feel sick. My doctor said my labs are normal, but I still feel sick and tired a lot. Can you really heal from an autoimmune condition? What does it take to really thrive with autoimmune conditions? What role does stress play in autoimmune conditions? What is really the best diet for autoimmune? And on and on and on. This is Anna Laura Brown, host of Autoimmune Rehab. I started this podcast because I was diagnosed with Hashimoto's in 2018 and wanted to inspire hope and transform health for people with autoimmune challenges. So keep listening and let's get you the help and hope you really need. And for today's episode, I am really excited because, well, some of you, if you followed me a long time or have read other things or listened to some of my other episodes will know that I'm a big fan of red light therapy. I have never actually had a guest expert on, and so we actually have that today. And he is going to talk to us all about his years and years of experience with red light therapy. So welcome to the podcast, Dr. Carl Rothschild, I think is how we say your last name.
Well, it's King Carl. Yeah, it's Dr. Carl Rothschild. You're right.
Okay, awesome. So welcome to the podcast, Dr. Carl. And why don't you start off by telling us a little bit about yourself? Who are you and what brings you here?
So 1973, I decided that I was going to become a chiropractor. And I did it because we were hippies of the time, my girlfriend, friends and all. And chiropractic just suited our need. It wasn't about money. It was about helping people. And so in 1978, I became a chiropractor, and it's been glorious ever since. So we're talking about 46 years or something like that. It's been a long time. About 26 years ago, when I, at that point, had been in practice about 20 years and figured I knew everything, I was introduced to red light therapy by the guy that brought the whole thing to the United States. He was a medical doctor out of USC, professor there as well. And he was fairly well renowned. And he said, shine a light on somebody and it's going to make a difference. And of course, I didn't believe it. I mean, how could you believe that shining a light on somebody is going to make a difference? We all learned such intense techniques and working this and moving that and what the diet and all that stuff. It was really complicated. And now you're going to tell me that all I have to do is shine a light on a part of a person's body and it'll make a difference.
Yeah, I know. It seems almost incredible at the beginning. It almost seems like, how could that be? But I've experienced it. Red light therapy can be really amazing. So why don't we start at the beginning with a little bit of a basics? Why don't you share with us a little bit, what exactly is red light therapy for people that have maybe never tried it or never heard of it?
Okay. So red light, I just want to finish up so it'll lead into red light. What they had discovered, this was a technology that they've been studying for 50 years. And there are numerous, it's all about the rainbow, right? From one end is violet, the other end is red. And past violet is ultraviolet, past red is infrared. And infrared has two main ranges, far infrared and near infrared. What they were studying for 50 years, and when I came on board, was near infrared. It's the miracle wavelength. It's the thing that makes the huge difference. You can hear about all these other colors and all this other, I don't care about that. I mean, I do, but near infrared trumps all of that. So I started 27 years ago in red light therapy. And I also, as I had mentioned before to you, before we started that, I also wrote the book. And I'm in love with this stuff. This has made such a huge difference. As I had said, when I had started as that hippie, my goal was to help people. One of the things we wanted to hear feedback from people is how great they feel, right? Now, more than ever, we're hearing, thank you for giving me my life back, more than ever. And what else could there be? That's what it's about. And you talk about autoimmune. I want to get to that in a little while. But now let's talk about what red light therapy is. When I talk about red light, I'm talking about the combination of red in a certain wavelength range in the rainbow, so to speak, and near infrared And we combined those two together. We were the first company to do that 12 years ago. Now, why did I do this as a manufacturer? We started 12 years ago because not only did we know that near infrared could do all that healing, and we had learned that all those years, but then we also discovered that red helped to shrink fat cells. And I went, oh, doesn't damage it. You're not freezing it. You're not boiling it. You're not ultrasonic cavitationing it. You're not radio frequencying it. You're not killing fat cells at all. You're not injuring, damaging, anything like that. There's a mechanism on it we can talk in a little while, but it's an all safe, wonderful process that assists in losing fat. And that's when I said, you know what? I'm going to take this to a whole nother level. And I started manufacturing. And we were the first ones to integrate red, which helped with fat loss and some healing, and the near infrared, which helped with all that. Didn't do anything for fat loss, but it was marvelous for the healing part. And the beauty of integrating them both, if you're looking for fat loss, you're looking at somebody who's worried about sagging skin or stretch marks. That doesn't happen because the near infrared tightens the skin. And in fact, the skin in general is going to look phenomenal. At any rate, so you're talking about an element of red that has been shown to be nicely healing and fat loss and near infrared. That's what red light is about. Now, I have 1,000 things to go over with you. At one point, I'd like to talk to you about how does it work and why does it work? And why is it so global? Why is it that I have yet to find very many people who we couldn't help? And I don't mean subtly. Like what I often do when I do lectures or I talk to people on podcasts and webinars is I ask the question, pretend that if you're not a provider, pretend you are. If you are a provider, answer this question. What would you do if someone called you up and said, I'm having a heart attack on average once a week. Can you help me? Nobody else has. Can you help me? So what they did was a little over 12 years ago, they implanted a defibrillator into his chest. So every time he died, it would zap him back to life. And by the time we saw him, he was dying. His blood supply was shot. His heart was, miserable. And every organ, every gland, every tissue in his body was suffering. He would talk about how the little old ladies in their walkers would zoom past him, relatively speaking, because he could barely make it around the block when he would try to exercise because he was an athlete as younger. So what would you do? What would anyone do? So the provider called me up and said, should I even treat this guy? I'm worried he'd have a heart attack in my office. Should I treat him? I said, look, just treat him for 5 minutes and stay in the room the whole time. And we did not know the full extent of what would happen to him. And after that first visit, that first 5-minute visit, he went home. He hasn't had a heart attack since. That was a year and a half, or more than a year and a half ago. He's had more treatment, no more heart attack. 12 years, hundreds of heart attacks, no more heart attacks. And everything has come back to life. Blood pressure, pulse, every organ, gland, his energy. He talks about his erectile dysfunction, and all these things have come back to life. And did I anticipate that? No way. I hoped for the best. One thing we know about, and that we've learned 26 years ago, is that the worst that'll happen with red light therapy is nothing. You couldn't hurt somebody. If you have the right device, with the right equipment, with the right wavelengths and frequencies and all that stuff, you couldn't hurt somebody if you tried. So it's the safest thing I've ever heard of. And again, as a chiropractor, we love toys. Chiropractors have, if you open up a chiropractor's office and look in his rooms, you're going to see more toys than you can imagine. They go to a seminar and they go, I got to have that. I got to have that. And they don't work as well as they had wished they would.
Yep.
And I've tried everything also. I mean, I have had 12 practices, 46 years as a chiropractor. I've had all the toys and they were good. I mean, at the time I thought they were great, but they were good in retrospect. Because now we're in the miraculous world. We're no longer in, well, I think maybe it might work. Now we're talking about, like, have you heard of Charcot-Marie tooth disease, autoimmune disease?
You know what? That's not one I've actually heard of.
So Joey had Charcot-Marie tooth disease, and he couldn't walk, pain every day. And
Mhm.
after 6 visits of red light therapy, combined red light and near infrared, doesn't hurt anymore. Not only that, he's walking for the first time in years, and it's the first time ever that he's walking his dog on a treadmill or outside on a bicycle, and he's loving his life. And he was the first one that looked in the camera and said, "Thank you for giving me my life back." And now since then, we've been here, and that he was one of the first ones that started using our more advanced full body equipment.
Mhm.
And now we've heard it a lot more often. Thank you for
Mhm.
giving me my life back, or some version of that.
Mhm.
But what we learned, it's about bathing the entire body at the same time. I don't mind a face mask. I don't mind a laser on an elbow or this or that. They're nice. I've had it all. I've used it all on my patients and whatnot. And they're nice. But it was the reason why we built the bed was because of COVID. Our
Mhm.
practitioners wanted less physical contact between the patient and the provider. And
Mhm.
so what we did was we created the bed because the patient can get in and out of the bed themselves. You don't need staff. It's a done deal. And but we did not anticipate the kind of results that we're seeing. And now we realize, or we've realized this for a while now, that when you bathe the whole body at the same time, that's what makes this unbelievable difference. That's
Yeah,
what to a whole nother level.
yeah, I can totally see that, just my own personal experience, because my first foray, if you will, into infrared lights was that I started with an infrared lamp. And, I'd shine it on different parts of my body and it worked okay. But then I got an actual infrared sauna and started using the actual full body, where you get in the full sauna. And that was definitely a much better experience. Definitely noticed much better results from, like getting in and having your whole body immersed in it. And so the first question that I would like to ask, I have a couple different ones that have come to mind actually, is what is the real difference between, let's say, like an infrared sauna and like the beds that you have, that are more of, obviously it's like chiropractors and healthcare professionals that are buying those and putting them in their offices.
An infrared sauna is a totally different, it's like night and day. So what you're talking about typically on first of all, in regards to red light therapy, heat is the enemy. The
Hmm.
last thing you want is heat, because what heat does is that's why when I take a heat pack off of somebody's back, their
Hmm.
back is bright red. That's what happens is that the lights actually the heat will dilate blood vessels, bring more fluid to the surface, and block the penetration of the light. The last thing you want is heat. In fact, when we built these 26 something years ago, we called it cold laser. They weren't literally cold, but they didn't get hot. What you want to do is
Okay.
generate energy that's kind of under the radar. The body doesn't even realize it's happening, so that you can get that deep penetration. The if typically a infrared sauna is using a totally different type of infrared. As I had mentioned before, there were two kinds of infrared:
Hmm.
far infrared and near infrared.
Hmm.
Far infrared is what generates the heat, and it's just a nice way of getting heat. It's not going to make these miraculous changes that near infrared will. Near infrared is cold or shouldn't get hot. So if you're dealing with a device that's getting hot, there's either one of two things: it's far infrared, totally
Hmm.
different animal, or it's the wrong near infrared that's getting hot. And there are cheap Chinese knockoffs that do get hot. They don't know what they're doing. What you want is a highly efficient lighting system, and that's where the money is. That's what costs more, having the highly efficient lights. People say, how much power is the bed? It's not about power.
Hmm.
It's about efficiency. So it's about having, yes, a lot of power that doesn't get hot. And if you can do that, so 26 years ago, the device that we had was a total of 100 milliamps, milliwatts.
Oh,
So,
okay.
so it was 100 milliwatts. The whole thing, 100 milliwatts. Now with the bed, we have over 5,000 of these LEDs,
Hmm.
that each one is at 3,000 milliwatts. So one of those diodes that we have is twice as powerful or more, three times more powerful than what we had all the ways back then. What am I talking about? 30 times more powerful than my whole system was, and we have over 5,000 of them. That's the way technology moves, right? It gets better, it gets stronger, it gets
Mhm.
more effective. And so now we're able to penetrate very deep with really unbelievable power, and make a difference like we've never anticipated before. And I'm not talking about certain parts of the body, I'm talking about every part of the body.
Oh, that's interesting. Yeah, I actually haven't heard of the cold red light therapy. I'm used to the infrared saunas that get hot, and that's been my experience of what
Yeah.
I've used, and I've actually found it to be really beneficial.
Oh, there's no
But
question it's beneficial. It's not going to make. So let's talk about how the therapies that I'm talking about work.
yeah, exactly. That was going to be my next question, is exactly how does it work?
So
Yeah.
there are two completely different mechanisms. On the one hand, we talked about fat loss, and
Mhm.
that's one mechanism that was discovered a little over a decade ago. And on
Mhm.
the other hand is the near infrared that was discovered. They started working on it 50 years ago, but then more recent, I mean, it's been over a couple of decades where they learned how that mechanism works. So let's talk about the fat loss quickly and get that out of the way. Because the only thing what that does is there's an element of red light that'll actually help to make the fat cell wall more porous temporarily. So every cell in your body is under pressure. So if you put little mini pores, or what they call micropores, in there and make it more porous, allows the contents to leak out. And then with a certain unique protocol, you move the fat away from the fat cells and eventually through the lymphatic system, and eventually to the liver for use or elimination. And if that's done right, the results are not that subtle. They're pretty good. And if you combine it with what we call a calorically neutral diet, that doesn't mean your starvation diet. I don't like those typically,
Mhm. Yeah.
because they'll be good for the 3 months that the person's on that diet. And then when they go back to their normal way of eating, they're going to gain all of their weight and more. So, I've studied weight loss for longer than I wish my mother was an executive of Weight Watchers before I was 10.
Oh, well.
So I never ate a good thing in my house again after that. I mean, bean sprouts was instead of spaghetti. So at any rate, that's fat loss. And we'll talk about that. We're going to separate that out. I like it. It's fine, but it's not the miracles. The miracles are in the near infrared.
Mhm.
And so they weren't sure how it worked until they realized what happens is there is an element in in each cell of your body. Every cell in your body has this organelle called the mitochondria. Now, when I went to school, long time ago, we learned that there was one mitochondria in each cell. And the uniqueness of a mitochondria, it's been discovered, is it's the powerhouse of the body. It's the reason why you and I breathe oxygen and eat food, to create this important molecule called ATP. And that ATP is what makes your body function. And if you have a highly well-functioning mitochondrial system, you'll do well. It's dysfunctional mitochondria that will lead to disease and eventually to death. So what they discovered is that there's an element within that cell that will actually stimulate the mitochondria to come back to health via sunlight.
Mhm.
And that makes sense. We're on this earth. It's got a sun. It would make sense that the sun would have an effect on us more than you would realize. And there is a element in our body, a molecule called cytochrome C oxidase, which has this unique capability of being stimulated by certain elements of sunlight.
Mhm.
What we've done is taken 4 glorious, miraculous wavelengths of sunlight, not the UV light or any other thing that could cause problems, but 2 red wavelengths and 2 different near infrared wavelengths. We magnify it very much and then drive it into the person's body. And now we're not talking about making nice. We're talking about mitochondrial changes that can see things change like you cannot believe. And so it's about the mitochondria, it's about cytochrome C oxidase, it's about health, well-being, and we're seeing changes in people's bodies like I've never dreamt of before. So autoimmune is one of the common things that we hear about. Rheumatoid arthritis. We have this one lady, she had 3 forms of psoriasis. She had guttate psoriasis, plaque psoriasis, and she had psoriatic arthritis, and it was throughout her whole body. I mean, she was a mess. She would wake up in the morning with dactylitis, which is sausage toes, where the toes were black and blue and swollen and painful as hell. And after 2 visits, that stopped. But then all the other symptoms that she had, you could see the horrible psoriasis. She had bleeding on her ears all the time. She had horrible rashes across the forehead, down her arms, down her legs. Those all gone.
Well, so how long on average does somebody that has an autoimmune condition need to do this kind of a treatment, would you say?
You know, I've been a chiropractor, as I said, for well over 4 decades. And the common question is, well, how many more visits, or is it permanent? And here's the answer. It's 3 times a week until you reach our target. Now, this person over here is otherwise pretty healthy, and they're going to reach the target much quicker. But I'm not going to be a gypsy foreteller that's going to tell you exactly when that's going to happen. Your body's going to tell you. So it's 3 times a week until we reach our goal. That's the answer. And then once we reach our goal, the truth of the matter is people then say, is it permanent? I want to know if it's permanent. And I tell them, yes, it's permanent. If we can stick you in a freezer, make sure you don't get older, and you don't do the stupid things that you did to get you here in the first place. In other words, no, it's not permanent. And so we put people on a maintenance program to make sure that the goals that we set, that they made, that we can keep them there. So it might be once a month, might be once a week, to maintain the work that we've done so they don't slip back to that horrific state that they were in before. Does that answer your question?
Oh, it does. Absolutely. It absolutely makes sense. It's like, why, you know, I mean, I go to a chiropractor too, you know, and I originally started going, you know, years ago when I was having a lot of pain. And even though I don't have the pain anymore, I still go, not as much, but once or twice a month, usually, just because it's a maintenance thing, you know? Right. And I definitely notice the difference if I go, haven't really done that, but if I were to go, you know, multiple months without going, you know, I'm sure I definitely notice the difference.
So, you would notice the difference for sure. So that was my goal with all my patients, is that you don't take care of yourself for this week and then figure out, you have to take care of yourself, unfortunately or fortunately, for the rest of your life. And the reason why people don't, you know why people don't take care of themselves in some cases? It's most commonly because they're not scared enough. They don't see themselves as a 75-year-old sitting in a wheelchair, not able to feed themselves, not able to wipe themselves, not able to wash themselves, and burden on society, and, you know, can barely function. And I didn't want, that's what I was about. Now, I had patients came into my office, and maybe I'm ashamed to admit this, but there were times when I would think to myself, oh God, please don't let me wind up like that. I don't want to wind up like that. And I was scared. So I did really well in taking care of myself, more out of fear. Maybe it's not always that way, but I think a lot of people are not scared enough. So they're still smoking, and they're still drinking alcohol, and they're still not taking care of themselves. And, you know, I don't understand it. I'm not saying people kill themselves to take care of themselves, but just stay away from the obvious things, improve their exercise routine. Exercise is 3 times a week for, let's say, an hour. And of that hour, at least 20 to 30 minutes is getting your cardiovascular system going. Anyhow, it's a separate subject, a different podcast.
Well, and I would say that most of the people listening to this probably don't fall into that category anymore anyway, because one of the things I find is once you get diagnosed with an autoimmune disorder, that does scare you into taking care of yourself.
I would believe it.
Yeah.
Well, so can you think of an autoimmune disease that you'd be curious about? Whether, you know, I'm not telling people don't do all the other things that work for them.
Yeah, because that was the other question I was going to ask too, is what have you seen? Obviously, some people are going to listen to this and think, oh, this is a miracle cure. That means I can do this and then eat whatever I want and not exercise and not take care of myself. And I'm sure that's probably not the case. And you probably find that people that take care of themselves need it less and probably recover quicker, even though this is definitely something to help people. You know,
I consider myself pretty healthy. I'm 72 years old, and I get in the bed 3 times a week because I want to do what I've taught my patients to do. which
Mm-hmm.
is to age gracefully.
Yep.
And so I'm not going to be able to stop the universal killer, if we may say, is aging. We can't stop that. There's nothing you can do. You're going to get older, and nobody's, it's going to happen. You just want to do it gracefully. I liken it to a candle that burns brightly from the beginning all the way to the end and then sputters out and dies. Not the last 20 years of your life living in an old age home that you can't communicate because you're dementia, Parkinson's, all these things are getting in the way. Now, some things you can't help, but the bed, we had this one lady who was all very upset about the fact that she had severe tremors, that she couldn't go to church comfortably because she couldn't hold the Bible.
Yeah.
And after 2 weeks of using full body red light therapy, she was easily able to hold the Bible. She still had tremors, but they were so much more mild. So it's really about improving someone's quality of life. That's the most important thing. And that's what we're looking for in all these cases.
Absolutely. So I know the next question that's going to come up in people's minds is, okay, they're thinking, sounds good, would like to try it out. Do you have like a network of providers that have the access to these beds, or how would that work? Because, obviously a large portion of the audience isn't going to live anywhere near where your office is at.
Of course. I'm not in practice, so they couldn't be treated with me anyhow.
Oh, okay.
So we have hundreds of offices all over the country. So all they have to do is go to trifectalight.com.
Okay, so that's trifectalight.com. So we'll make sure we include that in the show notes so that people can go there. They can find a provider.
And then when they go to trifectalight.com, there's a section there of find a location.
Okay.
And they can either find a location, or if they, there are two kinds of people that might want to buy a bed like this, even though it's not a cheap piece of junk from China. This is a high quality, very relatively expensive device. But if a person has more money than health, those are the kind of people that buy for their home. But most of the purchases are for businesses, people who really recognize a couple of things. One, it's a great way to build a business. But two, it's a great way to help a lot of people in your community. So when you go to the website, it'll give you an option of whether are you looking to buy, or you're looking to just treat, or maybe both. And then we get one of our staff members will get back to them of what's the closest location to them.
Okay, yeah, sounds great. And sounds like the kind of thing that, if the closest location is pretty far away, you could potentially recommend that your chiropractor or acupuncturist or functional medicine doctor considers purchasing one for their office. Maybe you could try to sell that. Sell your doctor on it if it doesn't make sense for you to buy it,
I will tell you that of the hundreds of facilities that we have out there, they're all doing very, very well. Very well.
I'm sure. Yeah.
When you get people, in fact, I was just talking to this lady, and she's treating somewhere on the East Coast. I'm in California, and
okay.
She was telling me that she just referred 18 over the last month that she's been treating. She referred 18 people to the office where she's treating, because she's almost as nutty as I am. I am in love with this stuff. In fact, I have a staff member who made me this.
Get in the bed is what it says.
That's my.
For those of you listening on audio, that's what it says, is get in the bed.
It's a coffee mug that says "Get in the bed," and that's my attitude. My attitude is just get in the bed. In the 50 years that this technology has been studied, there's never been a recorded side effect, ever. And the other thing is, what I suggest people do is try it 6 times. If after 6 visits, they don't see any change at all, they might need a lot more than that. I don't know. But after 6 visits, if they don't see any change at all, which is I don't think it's ever happened, but then they would realize maybe this is not for me. But normally within 6 visits, people will see a change. In many cases, like Steve, he contracted Lyme disease when he was 12 years old. Yep. It ruined his childhood. It ruined his education. It ruined his social life. And of course, it ruined his potential career.
Well, Lyme's a big trigger for a lot of autoimmune. We've actually had several episodes of guests I've interviewed that got autoimmune after they got Lyme disease. So, if you're listening to this and have Lyme, we've got a lot of help for you. We've got this episode and we've got others too. But yeah.
Of course. So Steve got in the bed when he was in his 50s. So 40 years of something.
Oh, wow.
He was so depressed and his life was ruined. And so what I'm going to do is I'm going to send you some of the videos.
Okay.
So send that to your people.
Yep.
That on that you'll see Arnett, who was having the regular heart attacks. You'll see Jessica, who also had Lyme disease. She had 20 years of diarrhea. She had shingles. She had the 3 forms of psoriasis. She had uveitis, which meant that in one of her eyes, her eye pressure was over 180 when it's normally supposed to be around 10.
Wow.
And the only treatment they had for that, and that they have for that, is injections right into her eye. And it was harrowing, is the way I think might describe it. And after just a few visits, the uveitis was completely gone. So you never know. You got to try it. 6 visits. Let's find somebody near you. But again, just like you say, if there isn't anyone near you, then help us find somebody that would be near you, if not yourself, so that you would have an office in that area. Now, I also want to explain to you that, within that 6 visits, like I said, we've had these people with Lyme disease, shingles. I mean, you'd be hard pressed to find a condition, but the 2 questions people often ask is it safe? Are there any side effects? And I already mentioned that there's never been a recorded side effect. But the other one is contraindications. Are there some people that shouldn't get in the bed? And the truth of the matter is, the only contraindications are legal contraindications. They're not real contraindications.
Yeah.
And those 2 legal contraindications, one of them is a pregnant woman.
Mm-hmm.
Not because the lights could be harmful to the fetus or the mother at all, but because if that baby comes out anything other than perfect, they're going to want to blame somebody for that. And you don't want to be in that neighborhood.
Mm-hmm. Yeah.
So I tell everybody, you know what? Let's not treat pregnant women. How about that? But the minute she delivers, right afterwards, especially after a C-section, if they get in the bed, the recovery will be unbelievably fast. And the other one is active cancer. Now, that has to do more with your license. If you're allowed to treat cancer, me as a chiropractor, I'm not treating now, but I never treated cancer because that's a good way for me to lose my license.
Yeah.
If it's within your license, then I can have that discussion. And when someone gets our bed, we include 32 things with the purchase. So we include the training and the coaching, we include the marketing, we include everything the person's going to need to be highly successful in all the 8 categories of business. And the categories are skin, weight loss and healing, and men's health, women's health. I'm trying to remember if I can remember all 8. Also athlete. So if an athlete gets in the bed early in the day, their routine that day, whether it's a game they're going to play, I'm talking about professional athletes, or the workout. Some of these guys work out, their workout is much more intense than the game. And by the end of the day, they're exhausted. And when they wake up the next day, they're not 100%, not even close. Mm-hmm. But if they get in the bed, the end of that day, when they wake up the next morning, the term they use often is fresh as a daisy. They can't believe it. How much more energy they have, how much more stamina they have, how much less likely they are to have an injury. But if they do injure themselves, they'll recover much quicker. And one of the last categories is the psychological, mental, emotional category. So I had a lady that wrote me this email, and it said something to the effect of, she said, if this is how normal people feel, I can't believe I've been missing out all this time. She was so highly depressed, couldn't sleep because of the nightmares she was having, and she was unbelievably disappointed, let's say, in her life. And now she's not. So there's actually a mechanism where the lights can penetrate the skull, get to the brain, and actually make changes there that are good. And again, it's all about mitochondria, but it also increases nitric oxide. And there are many other ramifications of increasing the mitochondrial activity that other things happen as well. So the person's stamina, person's oxygenation, everything gets better. So anyhow, as you can tell, I mean, I wrote the book, and I do recommend that people, I don't make a dime off of this, but it's on Amazon. It's called Illuminated Healing.
Awesome. Illuminated Healing. Okay, so we will get the link to that as well. We will link that in the show notes. You can send me the video, some of that other stuff. So if you're really intrigued, we invite you to go to his website, find out where there is one in the area near you, see if you can try it out. But also check out the blog post that will come with this too, because we'll be able to embed the videos, link to the book, some of the other things. So you can get more details than what we're able to give, obviously, with an audio podcast. So thanks so much for coming on. Any last words of wisdom that you'd like to add on? Anything else that you haven't shared?
No, I think I did a great job.
Yeah, I think you did too, actually. I mean, I'm really intrigued. I think, it was definitely a little different than I expected. I wasn't aware of the, red light that doesn't get hot. So that's definitely been a learning lesson for me. So yes, if you found this episode helpful, check out the information. Please share it with anybody else that you feel like could benefit. And subscribe and follow Autoimmune Rehab. And we look forward to hearing to you on another time.
I changed my mind.
Oh, she's got something else he wants to share. Okay.
One thing I didn't bring up was Google.
Yes.
There is a form of Google called Google Scholar.
Yep. Mm-hmm.
And if you go to scholar.google.com and put in the word red light therapy.
Yep.
I wonder if your average listener would be surprised to know that they would get 3.5 million entries. Those are double-blind studies, research papers, articles, all kinds of stuff in regards to red light therapy. And so when you have a question, would it help this? Is it harmful for that? Again, no side effects in 50 years studying it, but even you can use it in the eye, in the mouth. When I get the patients in the bed, or I teach people about putting patients in the bed, I tell them, have the patients keep their eyes closed, but let that light get through the eyelid and keep their mouths open so we can also get to the tongue, the throat, and all that sort of stuff. So Google Scholar is a great thing. The other thing is our YouTube channel. It has over 100 videos on there. So if you go to YouTube and put in Trifecta Light or Trifecta Light Official, you'll see over 100 videos there. And the website, again, is trifectalight.com.
Okay, awesome. Trifectalight.com. We'll link to the YouTube channel too, so that will be good. We'll probably find a couple of the Google Scholar articles and link to those as well. We'll find a few that are, the better ones, and because there's always some that are better than others, and we'll link to those. And thanks so much for sharing. And yeah, like I said, feel free to please subscribe, follow the show, and share this episode with anybody else that you feel like could benefit from it.